A 42-year-old man presents with progressive weakness. It began in his legs and has ascended to his upper body over the past week. In addition to the weakness, he also reports tingling sensations and a recent history of gastrointestinal illness just 2 weeks prior. On examination, he exhibits a loss of reflexes and diminished muscle strength. To further our understanding, a lumbar puncture was performed, revealing elevated protein levels in the cerebrospinal fluid without a corresponding increase in white blood cells, a condition known as albuminocytologic dissociation. Moreover, nerve conduction studies show slowed conduction velocities and conduction blocks, consistent with demyelination. Guillain-Barré Syndrome is an acute inflammatory demyelinating polyneuropathy, often triggered by infections like Campylobacter jejuni, cytomegalovirus, or Epstein-Barr virus. It is characterized by rapid onset muscle weakness that typically progresses over a few days to weeks. The diagnosis of Guillain-Barré Syndrome, or GBS, is primarily clinical, supported by specific diagnostic tests. Key diagnostic features include progressive motor weakness in more than one limb and areflexia, a lumbar puncture revealing albuminocytologic dissociation, elevated CSF protein without pleocytosis, is highly suggestive of GBS. Nerve conduction studies and electromyography, or EMG, are crucial in confirming the diagnosis, as they demonstrate features of demyelination such as slowed conduction velocities, prolonged distal latencies, and conduction blocks. Additional supportive tests include MRI, which may show nerve root enhancement, though it is not essential for diagnosis. The management of Guillain-Barré syndrome involves supportive care and specific therapies designed to modulate the immune response. Intravenous immunoglobulin, or IVIG, is administered at a dose of 0.4 grams per kilogram per day for 5 days to neutralize pathogenic antibodies. Additionally, plasmapheresis, typically performed in 5 exchanges over 10 to 14 days, can also be used to remove circulating antibodies and inflammatory mediators. It's important to note that corticosteroids are not recommended for GBS treatment, as studies have shown they are ineffective. Patients with Guillain-Barré syndrome require close monitoring for complications such as autonomic dysfunction, respiratory failure, and deep vein thrombosis. Supportive care is crucial and includes physical therapy, pain management, and the prevention of complications like pressure ulcers and infections. Most patients begin to recover within a few weeks to months after onset, but it's worth mentioning that some may experience long-term weakness or sensory deficits. The journey to recovery can vary significantly from person to person,